Hey, Virginia. How are you?
I'm fine. How are you doing?
Good. All right. It is 5 o'clock. That same time we get together to make sure that we are willing to do what it takes to defeat COVID-19. In this worldwide pandemic, we have one time just about every day that we can come together, that we can be together, that we can get an update, but most importantly, we can recommit, all of us, to do what it takes to defeat this worldwide health pandemic. And I am so proud of the work that you are doing. More than what we have ever seen in history, you are battling an adversary and saving thousands of lives. And for that, I am eternally grateful. So let's start the way we always start, by knowing and saying that we will get through this. We will get through this together. Say it with me. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. And we're going to get through this together because by now we are pros, we are champs at following the 10 rules of defeating COVID-19. Those 10 rules start with, most importantly, being healthy at home. Healthy at home is even going to be in place when we are healthy at work. It means just because we can do a little bit more doesn't mean we should do a whole lot more. By just increasing what we do by a certain percentage, we can still be safe in the midst of a worldwide health pandemic while restarting our economy. But if we want to do everything at once, we can't be safe in restarting that economy. Avoiding crowds and gatherings, practicing social distancing. It's important. If you're going back healthy at work and everything you do at work, you should be practicing that social distancing. You should be wearing a mask at work, but that does not excuse you from standing closer than 6 feet apart. kycovid19.ky.gov. We have new guidance up there today for those industries and businesses that can restart on the 11th, just as important as it was on the first day. Applying for benefits. We are now down in March claims to 23,078. 22,356 have separation issues, meaning there are about 900 claims that aren't being contested or have major issues that have to be worked through. We want to get those 900 processed. Those others would still be in the regular, normal process, regardless of whether we were going through that. Prioritizing your mental health. And I had to admit to you all last Friday that I needed a day, and sometimes you need a day too. Make sure you take it. Make sure you get yourself in a place where you are healthy, because even as we move towards a normal, it's going to be a new normal, and it's going to take continued strength as we move forward. Don't travel. So we have other states that are following a different schedule than we are. We don't believe that that's necessarily safe. We believe a slow, gradual reopening is the better way to go, because the first person to charge out there is the one that's willing to risk people's lives at a greater degree than I will ever be willing to risk your life. I view every Kentuckian like a member of my family, and I want to make sure we're making wise and smart decisions. In fact, James, can you go ahead and can you put up a couple of the headlines we've been seeing from some other states? All right, so first of all, I want to commend Mississippi's governor. His name's Tate Reeves. We were elected at the same time. That's probably the only thing we have in common, and he'd say the same thing. Governor Reeves was planning this big reopening, I think starting today, but got a big spike in cases and paused it. Right? That's doing the right thing. It's saying that ultimately the virus is in charge of the timing, and we're going to protect the health and safety of folks. I hope he keeps after that. But what we're seeing in a number of places that are opening up or that are more aggressive in their timetable is more cases or major concerns. Listen, I hope all those leaders are trying to do the right things, but I want to learn from others that decide they want to be first. When it's being first at doing something that could risk people's lives, I do, admittedly, want to watch because I want to make the best, smartest decision for you. I want to make that decision that protects you and your parents and your kids. And I want to do this right. And I know the decisions that I make are going to be the difference between life and death for real people and for Kentuckians. So understand that I'm not going to be the fastest. I'm just not going to do that. And I don't think we can be doing that. I think we've got to be the smartest based on public health, based on a gradual phasing in where we can protect our population. So let's go back to the 10 rules. And that's only to be able to say, we have 10 rules plus one, fill out your census. If we are as focused on reopening our economy as we should be, then this is just as important as anything else. This is the amount of federal aid that we get in that helps in a lot of programs out there that can help us reboot this economy faster. So we ask you to follow the 10 rules, fill out your census, and then also model that behavior we need to see. And I know it's been a while that we've been in this, and we see some fewer posts than we did before. But I need you to recommit, especially as we go back to being healthy at work and needing everybody to be following the guidelines that are out there for healthy at work to be safe, to continue to post what we need to be posting to these hashtags. Let's look at a little bit of what we have today. All right. This is State Representative Buddy Wheatley, and this is one of his constituents, 100 years old today, Juanita Rose Buchel of West Covington. Again, even a 100-year birthday party. She's trying to do it safe. Those special moments, and this only happens once every 100 years. It only happens once every 100 years. And we're in a once every 100-year event, but wanting to make sure that people are safe, and even being willing to put off something like this shows you how important it is that we follow these rules. All right. We talked a little bit about Horses and Hope, Horses for Hope, visiting again our nursing home facilities. Even as we enter phase one, this virus is still there, and it's especially dangerous to those who are in these facilities. So we got to know it's going to be a long haul for our residents, and we got to do everything we can to protect them. And this type of giving makes it maybe a little bit easier on those that can't have visitors right now for their health and for ours. So this is near the end of the school year. My kids are struggling with it. They love their classmates. They love their teachers. My son is graduating from elementary school. So many folks out there graduating from high school or even college, and it just being different this year. And we can't control once in every 100-year pandemic, but we can control how we respond to it by putting other people first, by putting our health and safety first. And again, this is just appreciation shown to our educators and an acknowledgement of the situation that we're in. Yeah, this is some of our kiddos whose parents work on the backside of Churchill. Gretchen, one of my former co-workers at the Attorney General's office, running the Backside Learning Center program, the good work that it's doing, trying to make sure that people are taken care of. Again, our healthcare heroes. You see all the PPE that they have to wear ought to remind us of the risk that they put themselves in, and that ought to make sure that we are following the rules that we need to protect them. Yeah. And this is what we see everywhere from every faith all across Kentucky. Compassion is something that we all share, regardless of our background, regardless of our denomination, and regardless of our faith. And while a news cycle may want to take us in a different direction or The 1% of people that might not agree want to take a lot of attention. We are more united than we have ever been, at least in my lifetime in this state. We have a common enemy that is COVID-19, and our actions impact other people at a greater level than ever. Knowing that my decisions about being willing to wear a mask today, what I do, reducing my contacts, could be the difference of somebody else living and dying. I try to remember that every single day to make the right decisions to protect other people. So every day we talk about the 10 rules, we talk about the 11th, the census, we go over social, and we learn a little bit of sign language because as we're being compassionate and kind, we want to make sure that we are including everybody in that. So today, Virginia is going to teach us proud of you. Proud of you. One more time. Proud of you. And we, both Virginia and I, are proud of you for everything that you are doing to protect one another. Your actions are special. They are selfless. I don't think we've seen this out of a generation in my lifetime. And it doesn't just make me proud. It restores a little bit of my faith in human beings, that we are ultimately willing to sacrifice what we have for everybody else. That's important. It's special. It's one of the things that we can take out of this. And it's one of the reasons that I hope, even when we get back closer to the old normal, that we are different, and we are different in a good way moving forwards. All right, so we have a lot to talk about today. A little bit about where we are, about testing, about tracing, healthcare phase 2, healthy at work and guidance, Green River, and then our numbers. Tomorrow we're going to have a longer report from Mr. Benton on unemployment. But let's talk about where we are today. So even when you see the numbers that we have today, which are really steady, we are at a better place at this point in time than I could have ever imagined, because this wasn't just going to go away. We were going to do our best to flatten the curve, but you've done more than that, right? You've plateaued it. You've cut the top off the muffin. Even with more tests, we're staying at about the same numbers. And we hope that when we see more data, that we are potentially even on the decline. But right now what we know, which is good news, is that these cases aren't escalating in Kentucky. But I do want to reinforce that they're not escalating in Kentucky because of the steps that you have taken. And that doesn't mean that the virus is gone. Some people see stable numbers and they think it's no longer contagious, and it is. People see stable numbers and think it's no longer deadly. It is, because we continue to see deaths. So let's remember, even as we work at being healthy at work, this is still a very scary virus out there, and I'm using that term intentionally, that we have to be gradual, we have to be smart, and we have to make the right decisions, and we need everybody on board. Remember, how well we're protected depends on every individual's decisions. It depends on, when we make 10 healthy at work rules, if you might not like one, we still need everybody to ultimately comply with all 10, because that's how we're all safe. It could be the one that you don't like ends up being the one that's most important. And you want to do everything you can to protect everybody around you. I believe that. So making important decisions is critically important going forward. Let's not be first. Let's be the best. Let's be the smartest. That's how we've gotten where we are right now. Testing. I'm pretty excited about this. So this week, we're going to have 17 different testing sites, and this is just drive-through testing sites in Kentucky. As you look at this slide, and I hope they're going to it full screen because there are so many, you have everything from our Kroger sites in Ashland and Bowling Green, Louisville and Lexington, to Rowan, Trigg, Perry, Pendleton, Oldham, Mason, Montgomery, Christian, Callaway, Bracken, Jessamine, and Laurel. we are seeing more and more of this, and this is May 4th through May 8th. So go to our website to see exactly who is eligible and how to sign up for each and every one. To give you an idea of the Kroger sites, right now we have booked Louisville, Lexington, and Bowling Green fully through Friday. Ashland still has about 100 spots left on Wednesday and about 300 spots left on Thursday. Let's make sure that we fill those slots. And then I'm excited that we have a new partnership, and these are the types of partnerships that move us forward with St. Elizabeth and St. Elizabeth Healthcare on setting up a drive-through testing facility in northern Kentucky. This is on the border of Kenton and Boone County. We have a new slide when James pulls it up. Anyone qualifies. It's by appointment only, and it is at no cost. It's going to start on May 11th and run at least through May 15th, and it's going to be from 8 a.m. to 6 p.m. And if we don't get it up here today, it is going to be on our website. So let's make sure that we ultimately fill those slots. And this is something that Northern Kentucky's been hit hard on. This is something that was requested, and we have worked and worked and worked to get it done and to make it happen. So do we have a slide on that? All right, it's coming. Kenneth, if you're at home, if you can pull it up. Okay, just wanted to make sure that we got this up for people to see. So just because we have drive-through testing doesn't mean we don't have other forms of testing. You know, if you are symptomatic, if you are sick and you call your healthcare provider, they should be able to arrange for a test. We're also sending tests out to a hospital, multiple hospitals in every day. So this is St. E's and what they're doing through their drive-through testing and through physician consult testing. But you know what? They've been willing to put other providers in their area on this slide, or we were willing to put it on the slide, to make sure that you know that there are other facilities that can do this. Knowing where to get tested is going to be incredibly important as we move forward. And we believe, as we have increased our capacity with Gravity, we have more programs going on with Solaris, a lab in Nicholasville, that we are going to be able to exceed the 2% monthly amount that the White House is recommending on testing. We think we're going to be able to get beyond that. That's about monthly is about 88,000. We believe that we are going to exceed that as we ramp up. Our hope is to do more than that to make sure. I think right now we believe we can hit at least 3% of the population. Our numbers are right about there if I calculated them right earlier. All right, so in our new normal, we got to have a lot of testing. We got to have a lot of testing. We got to test our healthcare workers, our first responders, make sure they're okay. We got to do a lot of testing in our long-term care facilities because of the danger that's there, and in our prisons and in our jails. We also have to test the general public. How many people are asymptomatic and might be spreading it? We got to make sure that we know that data. And then we got to have a direct bridge between employers for Healthy at Work to be able to send those that have fevers or other signs to get tested. But the next piece is the tracing. So if someone tests positive in our new normal, we're going to have to call around and figure out who they've been in contact with. And in our new normal, if we want to open in a worldwide health pandemic, we have to accept that if we get a call and we have been in direct contact with someone who is positive and contagious during that time, that we're going to have to self-quarantine. That's just the way the world is going to be until we have a vaccine. So we have an RFP out now for a partner that will help us hire about 600 different folks to do contact tracing. That RFP is due on Friday. So for folks out there that would bid, we'd like to have a lot of competitive bids. We'd like to hear about a lot of different models. We want to be very supportive of our local health departments. They do a great job. We want to be able to provide them the best technology, the best support, and we also want to move that support around the state. Bowling Green hit really hard recently. Other areas as well. We want to make sure we can move the support where the need is greatest to make sure that no one ever lacks resources to do the tracing. All right, now let's move into healthcare phase 2, which starts on Wednesday. I'm going to ask Dr. Stack to talk on that. And then he's also going to mention our Battelle project that he had mentioned last week, where we're now going to be able to clean N95 masks to make sure there is a better and greater supply for our healthcare providers. So, Steve?
Thank you very much, Governor. It's good to be back, and thanks for a few days away from the camera. It was a nice break. I have a few things I wanted to update. First of all, to put these things into context, the disease is not gone. And I've tried to be very measured whenever I speak and whenever I share information. I don't want to instill fear or false sense of security, just the realism that we have a serious disease spreading through the community, and we have to take steps to try to minimize the harm it will cause. So we are seeing now, as states lift restrictions in different ways across the country, a large social experiment, and we will see what the outcome of that is. I am very grateful that we're taking a measured approach here in Kentucky, because overall in the United States, a relatively small percentage of the population has been infected. So if we lift all these restrictions very quickly, what will happen is the very problem we've sacrificed so much to prevent. Now, people have asked about what models we use and where we find information, and I've said repeatedly we look at numerous different models. We look at a whole variety of publicly available models, and we use our own internal data. And one of the reasons I haven't showed a lot of these specific ones or gone into great detail with state-specific modeling is because none of them have been shown to be correct yet, because we've changed so many variables by adjusting social distancing, by using new precautions as we've gone along now, by recommending masks and different sorts of behaviors. We're actively changing those variables, and so the models, as good as they are, they try to make a very serious attempt to predict the future. No single model has accurately predicted the future. What we can see, though, is where the disease has taken off. So in places like Wuhan, China, in New York City, in Italy, it has been devastating. It has overrun hospitals. Healthcare workers have experienced severe distress. The deaths have been staggering. This is not something we ever want to see here in Kentucky, and thankfully the steps that Team Kentucky has taken have helped greatly to reduce this first wave, but we're in this for the longer haul, and so these steps are going to continue to be very important. James, could you show the healthcare phase 2 reopening slide? There should be a new one for this. So we are in healthcare phase 1 reopening as of last Monday. This Wednesday we do healthcare phase 2 reopening. This now means that elective outpatient and ambulatory surgeries and procedures can occur starting this Wednesday. There's some examples. These are not exhaustive. I know everybody looks to see your example on the slide. These are not exhaustive. They are representative of the sorts of things that will happen this week on the left. So colonoscopies or EGDs for upper endoscopy, or if you need a heart catheterization, if you need your knee surgery where you go get the surgery and you go home the same day. Those sorts of things now will be able to happen this Wednesday, but they all have to comply with new rules. So healthy at work applies when you're healthy at the hospital as well. And in fact, if anything, there's additional protections because of the unique characteristics of hospitals and surgery centers where people have higher risk. And so on the side here, these examples like universal masking, temperature and disease checking when you go into the hospital to make sure sick people aren't permitted to come in, using social distancing, so you shouldn't see traditional waiting rooms at these healthcare facilities like you did before. And I won't go over the entire list, but you will be able this week to take advantage of healthcare services that we've not been able to for a little while. Phase 3 and 4 will happen starting next week, and then Phase 3 will be May 13th, and Phase 4 will be May 27th. And then can you show just real quick the Battelle slide? Do you have that separate? As we start to reopen healthcare, it will be very, very important that healthcare facilities make judicious use of the PPE, because PPE is still hard to get. This Battelle system is available to all healthcare providers. That means medical doctors, surgeons, dentists. If you use PPE to provide healthcare services, you can register for this. I urge you to go to the website, sign up. They gave us an example of some office sending in 15 masks a week and getting them back. Please make use of this. This is how we're going to make those N95s last longer while the supply chains continue to get worked on, and hopefully we get better access to PPE. So Team Kentucky, you've done a great job. I thank you very much for all your sacrifice. You've really done a fantastic job keeping each other safe, and I thank the governor for his actions, because I think without the partnership, we would have been much, much worse. All the models would have said we would have had a horrible story to tell right now, with hospitals overrun and substantial deaths. And though we've had losses, and those are sad, we have done a great job minimizing those to a great extent. So thank you very much, Governor.
All right, so next week, on Monday, we begin phase 1 of Healthy at Work in the business sector. And we always have to start that with the 10 rules about being healthy at work. Now, they were up on the side of the slide that Dr. Stack was using. And all of these are critically important. And I've gotten different questions ranging from, if somebody has a fever but they claim it's for a different reason, can they come into work? And no, we have to keep people who are showing signs of infection out. To how do we get PPE? Can we open without it? The answer is it's not safe if you open without it. But today we do have some good news. I'm excited to announce our partnership with the Kentucky Chamber of Commerce and the Kentucky Distillers Association to get PPE and hand sanitizer to our small businesses so that they can participate in Healthy at Work. Acquiring the necessary PPE is a big challenge. We've been through it at a time which was probably the most difficult time ever to purchase it. So the state's working every day to secure PPE, but that PPE has to be used for our nursing homes and for our healthcare sector, and to prepare for, if we have one, a spike in the future that the experts tell us that we will have. So we have to have a way for small business and others to be able to get what they need to gradually reopen. So the Cabinet for Economic Development has worked at the Chamber, and together we've been able to purchase 200,000 3-ply masks that are available to Kentucky businesses. For people going back to work in a couple weeks, masks will be a part of the new normal, and businesses can't open up if they don't have the PPE they need. So getting the masks is crucial. They aren't free, but the Cabinet and the Chamber are working together to make sure we have the necessary supply going forward. Masks can be purchased at this link. They're $1 each. The Chamber's paying for masks, and they're buying them from a company. These masks can be shipped anywhere in the state, and the first shipments are going out tomorrow. Average purchase price for 2 to 3 boxes of 50 is what people are buying, which means the vast majority are going to small businesses. Businesses also need hand sanitizer for both their employees and their customers. Kentucky's distillers, both large and small, have stepped up in a big way, retooling production to make this sanitizer. To date, the distillers have donated more than 150,000 gallons of hand sanitizer to our healthcare providers. So businesses in need of hand sanitizer can visit this link and put in a request to purchase sanitizer with the Kentucky Distillers Association. Now, this is kind of part of our new normal, creating new supply chains from folks right here in Kentucky. When we look back on our story of how we responded and what we had to do, what we're going to see is Kentucky Labs stepped up to provide the testing that we needed. That's Gravity, that's a company called Blue Water, and it's also the Nicholasville Solaris. We're seeing the same thing right here in how we are purchasing and providing PPE. So Kentucky, I'm proud of you. I mean, more than anywhere else, we have had to step up and do this on our own, and we are doing it. We want to thank Kentuckians for helping us to buy the time. And with their social distancing, we need you to keep that up as we move through it. But this is one where our accomplishments are going to be ours. The Kentuckians can own the lives they saved, and what they have been able to do. Now, with a little more May 11th guidance that we've put up, my Chief of Staff, Latasha Buckner, is going to walk through a little bit of that, and then we'll follow that almost directly with the Green River update.
Thank you, Governor. Our Healthy at Work reopening team has been hard at work over the last couple of weeks. We've been having great conversations with the Chamber of Commerce, local businesses, and we've been using the Healthy at Work website to review your proposals. At this point, we've had over 1,000. As a reminder, you're not required to submit anything, but it is the way that we're able to gauge what your industry is capable of, any limitations or special considerations that there might be. And so now on our website, and James, I think you have a new slide for that, we now have the requirements, and we always have the minimum requirements that the governor's gone over a little bit about the special accommodations, the testing plan, social distancing. But in addition to that, you will now find requirements for industry-specific models, which are manufacturing, construction, I didn't bring my glasses, vehicle dealerships. And so an example of industry-specific consideration there would be at car dealerships where interaction is unavoidable at times. We require dealers to limit the number of persons in the showroom, allow solo test drives, and submit all paperwork that can be filled out by the customer or electronically on their own or in one location. We've got pet grooming, care, boarding. An example of that would be an ability to leave a pet in a place where the groomer can pick it up without much interaction between the customer, the pet, and the groomer, and then also to be able to pay online. For any industry that is set to open but can't meet those minimum requirements, you can't open. I mean, that's kind of the give and the take on this. And if you can't meet your industry-specific requirements as well. In the upcoming weeks, we have some other announcements on May 20th. It'll be retail and houses of worship, and we plan to get that guidance to you as well in advance so you have time to prepare and gauge whether or not you're able to open up. And then on the 25th, the same thing with personal gatherings of up to 10, barber salons. We've gotten a lot of feedback from the cosmetology industry that we are going through as well. And it's important that you meet these guidelines, these requirements, because they allow us to be healthy at work, and that allows the successful reopening and to make sure that we're making advancements and staying at the plateau level and hopefully declining responsibly. Thank you all.
James, if you'll leave that up, we hope to have a couple of things coming out the next week to week and a half. First, a government reopening plan. Right, we've had healthcare, business, and government would be next, but also phase 2, which will include things like restaurants, and will be in June. We want to have that out within the next week and a half. But again, with the amount of work and going through what we're going through, it's going to take a little bit of time to generate. But I hope everybody sees this and sees hope. Hope that while it's a new normal, we will be able to do more things. But until there's a vaccine, we're never going to be able to do 100% of what we did before because we know that's not safe. So work with us. There's real opportunity out there. There's a better day ahead. We just have to get to it. And I will say today, I've been on calls with human resource professionals because a lot of what they're going to have to do in enforcing these rules is going to fall on them. I've been on a call with county judges, and then I've been on a call with the Kentucky Council of Churches. A very, very good call on May 20th. And again, want to reiterate that just because you can't open doesn't mean you're ready to and doesn't mean you should. Very thoughtful consideration going in from all of those faith leaders. And I'm going to support the decisions they make about what dates work for, whether it's their individual houses of worship, denomination, or other. We're all trying to do the right thing. And that's to make the safest decision that we can with all these circumstances. They want their flocks to be safe. I want my people, which is all the citizens of Kentucky, to be safe. All right, next we're going to get an update on Green River Correctional Facility from Michael Brown. Michael is the secretary of all of our cabinets. He was also the former Justice Cabinet Secretary and the Deputy Attorney General. Not in our numbers today. Some numbers today were from Green River. We expect to have up to 120 more positives in that facility, and we believe that we're going to have one additional death as we're reporting tomorrow. This is what people are seeing all over the country in specific facilities. It's a challenge, and it's a concern, and it's something that we are all concerned about, and we're going to be working very actively to address. So, Michael Brown.
Thank you, Governor. And I'm going to need a slide of Green River, but first let's talk about some of the materials, the first line of defenses you'll see as we talk about Green River. One is, of course, is the cleanliness and the sanitation, hand sanitizer. We all need to be doing. That's part of the things we should be doing every day, along with washing our hands. Face masks. They are being passed out to all of our correctional institutions, and everyone at Green River, staff, inmates, all have them. And temperature checks, and I'll show you an example of that as we go along. In fact, Dr. Stack was kind enough to take my temperature right before we walked down here, for this briefing as a demonstration of how this works, and that's one of the first lines of screening that you'll see. Well, there's a temperature check right there. It's not at Green River because we haven't been photographing down there. That's at Bell Forestry, but that's exactly how it works. You can see the PPE on the individual, and they literally put this up, a thermal scan. The advantage to these is they don't have to be sanitized afterwards, so you can continually use it as people come in, and it's a big advantage to all of us. And by the way, we have a shipment of more of these thermal gun thermometers on the way to Green River, and they'll be arriving there tomorrow. Now, if we can get a screen of the institution itself. You got that? Now, Green River is a Green River Correctional Complex. It's located in the Central City, Kentucky. It's built to accommodate, all right, I don't have the overhead, but, and if we have to do it again, we'll do it later on in the week. But it's built for 982 capacity. Last week, we managed to test 875, and we also tested staff. So everyone who was at or working at Green River got tested last week. And as the governor said, all those results, because there's a little bit of lag, particularly with the weekend and all those results coming back. So we can't give you the specific number of positives that have come back there. But we do have is working with Dr. Stack, Dr. Spicer, his staff, and the Department of Corrections. We've come up with a very comprehensive plan of how we're going to deal with the population at Green River. And we're basically going to divide it into 3 housing unit groups. Then those unit groups will be first those who have tested positive. And we're going to house them in a singular housing unit. And the physical facility down there allows this to happen. The next group are those who have tested negative but who have been, here it is. All right, so as you can see, and you see the numbers on it, you have a cluster of buildings, 1, 2, 3, 4, 5, then 6, 7, and 8, and there is another that's 9. It's not easy to see in the photograph. So one of those units will be used to house those who have tested positive. That way we can isolate them from the rest of the population. Another unit will be used to test those who have tested negative but have had some direct exposure to someone else who has been positive, either immediately or in the past. And the third will be used to those who have tested negative but have not had any direct exposure to other inmates. There'll be another unit set up for those who are medically vulnerable. If you remember, the governor issued an executive order for those who were medically vulnerable under the COVID standards but who had not committed violent or sexual acts to be released from prison. And by the way, to this date, with all our commutations, we've released almost 1,200 inmates from across the correctional scene. But we'll have a separate place to have those who are medically vulnerable isolated from the rest of the population. So we have a lot of capacity to, now that we've had the testing, and this can be somewhat of a model, we think, for other places, where we can apply all these safeguards, separate these populations, and try to protect all of the people down there. The next thing we'll do, working with Dr. Stack and Dr. Spicer and his team, is we're going to do a follow-up testing of targeted populations after we have all the results back in, and probably between 10 and 14 days after these results come in. And I know that it's been a difficult situation for everybody down at Green River, but I want to commend all of those, particularly our correction workers, and in fact, the inmates who have cooperated, all for the health and well-being of everyone there. Thank you, Governor.
All right, thank you, Michael. And before we get to the numbers, lots of times we go over different areas. Let's have some positive news. So most of you all have heard me refer to Eric Freelander as our Secretary of the Cabinet for Health and Family Services. Technically, he's been the acting Secretary for Health and Family Services, but he has more than earned the full-time job. So as of yesterday, I believe, when I offered and accepted it to him, he is going to be our permanent head moving forward. He has done a phenomenal job. He has shown grace in times of great difficulty, and he's the exact type of person that I want to have, not only for this situation, but as we move beyond it. It's the right mix, understanding both things ranging from Medicaid to the DCBS, which is our foster care system, and more than just the mastery of the topic, the empathy, even with the decades that he has been doing it, to still care at his core about every single individual that we serve. And that's exactly what I'm looking for. So he's in the back of the room, and it doesn't get to give an acceptance speech, but I'm very excited about that news. All right, so today's numbers, again, have stayed in line in number of cases with what we have been seeing. We're reporting 163 new cases of COVID-19. After duplicates, people from other states, et cetera, removed, our total number of cases, our official number, is 5,245. That's one probable, and the rest of them lab confirmed. That's out of a total tested of 60,046. That's 60046. Total number ever hospitalized, 1,529. Currently hospitalized, 333. Ever in the ICU, 659. Currently 174. And recovered, 1,921. We'd love to see that number go up. New cases by county, 36 in Warren, 34 in Jefferson, 24 in Butler, 16 in Kenton, 9 in Fayette, 6 in Davis, 5 in Boone and Grayson, 4 in Campbell, 3 in Graves, 2 in Barron, Hart, and Ohio, and 1 in Bourbon, Edmondson, Hardin, Harrison, Hickman, Logan, Madison, McCracken, Meade, Nelson, Rockcastle, Spencer, Taylor, and Webster, and 1 we are still working to confirm. Now, yesterday it was nice to be able to say for at least one day we had no reported new deaths. Today is not the same as yesterday. We have lost 8 additional Kentuckians to COVID-19, bringing our total number lost to 261. So let's make sure again that we light our homes up green, that we ring our bells at 10 a.m., that we let these families know that they are not alone at this time of physical separation, that we care about you, and that we care about these 8 individuals we've lost, and that we know that you are grieving. They include a 75-year-old male from Jefferson, a 79-year-old female from Hopkins, a 98-year-old female from Jefferson, an 86-year-old male from Jefferson, a 66-year-old female from Hardin, a 69-year-old male from Jefferson, an 89-year-old female from Jefferson, and an 86-year-old female from Jefferson. Again, losing 8 people in a day, COVID-19. We want to do better. We mainly grieve for those families. So much of this occurs in our long-term care facilities, and we know that every decision we make about reopening, we've got to make sure that we are protecting especially the most vulnerable. Ethnicity and race information. Of overall cases, 74.79% white, 13.21% black or African American, 6.34% Asian, 5.51% multiracial, and ethnicity is 88.5% non-Hispanic and 11.5% Hispanic. On deaths, 78.26% white, 17.83% black or African American, 2.61% Asian, 1.3% multiracial, and of overall deaths, 98.15% non-Hispanic and 1.85% Hispanic. Now let's break down our long-term care facility numbers. I think it's important that we track these and are very transparent about it every day because remember that just because we've done a really good job at flattening the curve doesn't mean it's gone and doesn't mean it's less deadly, especially to our folks in these facilities. So we have 17 new residents have tested positive, 1 new staff, and 7 additional deaths. Again, that's different than the daily amount we announced because we got to go back for a couple days and confirm where people are. So a lot of our state time is taken up here, and as we move forward, doing things like Healthy at Work, there's going to be a lot of new initiatives that ensure that our long-term care facilities get the attention, the help, the testing that is needed. I mean, we have to take care of our folks, and we're working on it every day. All right, so today we have 4 journalists with us. We have Lawrence Smith and Tom Latek. Welcome back to both of you. Then we have Joe Sonka and Catherine Collins, who we have had. And then we have a number of written questions that have been provided. But I tell you what, Lawrence, for being back, why don't you kick us off?
Thank you, Governor. Louisville's business community, specifically GLI, expressing concern that Louisville business is at a competitive disadvantage because Indiana's opening up sooner. I guess the question is why are Kentucky and Indiana not coordinating more closely on that?
Question is Indiana and Kentucky having slightly different reopening schedules. I'm on a call every week with Governor Holcomb, and I think he's doing his best, just like I know he thinks I'm doing my best. And we talk about different best practices, how we address different things. We talked along with Governor DeWine about some of the testing in our prisons and some of the steps that we're taking. And so while we coordinate with that, at the end of the day, each of us is responsible for our people. I believe that our gradual step is the right way to go. And if I believe Indiana is doing something a little too fast, I mean, on a couple of those, I do. And Governor Holcomb knows that we have a difference there. Then I think less about the competitive disadvantage because we're maybe a couple weeks behind, and more about the health risk that may be imposed. So what I would ask Kentuckians is we've done a better job than just about all of our surrounding states, and just about all of them of flattening our curve. Let's not drive to other states just because they're doing something earlier if we think we have done it better. And we have stuck together as Kentuckians to make sure that we've protected one another. Let's stick together on our reopening plan so we know it's safe. If we believe that we need to do it gradually, and we have to, look at Mississippi pausing based on what they saw, then let's not frustrate that by going to different places. I'm going to talk to Governor Holcomb about especially the cities right on the other side of Louisville Certainly, we know what we have seen in that city, and I've talked to Mayor Fisher about that. Mayor Fisher and I are on the same page about how we think the reopening should be done and should be done safely. But that concept that just because somebody else is doing it, that you should do it in a worldwide health pandemic, I'm not buying that. I'm going to protect our people. All right. This is a question about something similar. Did our collaborations fall through with other states? No. Dr. Stack was on a call with their public health officials. We all have slightly different experiences, and then in the end, we want to coordinate, but we all want to do what's best for our people. If I thought that another governor was making a decision that's too early or being more aggressive or wanting to be first in something where lives could be on the line, I'm not going to agree with that. My job is to make sure we do it right, not to make sure we do it first. Joe.
Over 2 weeks ago, you put out specific metrics and benchmarks that would have to be met in order for businesses to reopen in the first phase. One of them was a 14-day decline of new cases. Obviously, if you take that literally, we have not done that. Did you make a conscious decision to back away from that specific requirement benchmark? And if so, why did you do that?
So the question is, we set out benchmarks that we wanted to meet before we did business reopenings, and we haven't seen our overall number of cases declining for 2 weeks. So did I back off of that? What was our thinking there? I believe that we kind of have three things that we have to achieve, and they're all different levels on where we are and what we can do. One is where the virus is. I will tell you, I never thought we'd be plateaued for 3 weeks. That's a great thing, even with more testing. So while we're not seeing the overall numbers go down, I feel very good about the behaviors that we've adopted as Kentuckians with a very contagious virus. And where we are, though it's still dangerous. We keep talking about that. That's why we're doing the gradual reopening. The second piece is testing, where we have significantly ramped up capacity. And now, with all of these sites, and we now have more kits, and the federal government is sending us a lot of swabs. It's a really exciting occurrence that hadn't happened to this level before. And so we have additional confidence there. We also now have the CARES Act money to hire the tracers that we're going to have out there and ready. So those three all kind of work in tandem. But what really led us to believe that we could go ahead and start doing the reopening is the gradualness of it, is doing the May 11th, but then waiting a period of time before we do the next step. That means we have a lower number of people that are increasing their contacts as we ramp up our testing, and as we hope that we will stay stable or start declining. And so it's the interaction of the gradualness of the phase-in, along with the testing increase and the tracing, and where we believe that we can get it. I mentioned Purdue Farms has not been cooperative after a virus outbreak at the Ohio County facility. We've received several calls from plant workers stating the plant is not counting positive cases for temporary employees, and employees are being fired if they decide to self-quarantine due to potential exposure. First, Dr. Stack is having direct conversations with the company. We hope that we are close to some very active steps being taken that are testing, and I'd like to see a couple of other steps. I received a letter from Sonny Perdue, who is the Agriculture Secretary, and basically all that letter said is we can't have, if we need to have temporary closures that don't have a restart date. No one ever wants that. This is important for the supply chain to make sure that any closure is temporary, but we got to get this right, and we got to protect people out there. And I want to make sure that we don't sacrifice in the short term for the lives and long-term health of our people. If people are being fired that need to self-quarantine, that is a real problem. And if positive cases aren't being counted for temporary employees, again, that's a real problem. I don't know if any of that is accurate, and we'll work with the company, and I'm not going to say that's true until we believe it's true. But these are people. These are Kentuckians. These are people living in our communities, and we need to make sure that they are going into a healthy work environment. And it doesn't matter if it started in the facility or if it's being brought into the facility. Remember, somebody can spread it no matter where they are. And so if you are a workplace and you know people are coming in who are positive, it's still your responsibility to do the right things to prevent it from being spread. This isn't it's their fault or our fault. This is human life, and we all have a responsibility to make sure we're doing everything we can to protect it. Tom, welcome back.
Thank you, Governor. Good to be back. You've been talking about Green River, and I know in the past you've talked about some of the other prisons.
Mm-hmm.
What's the status with them? Some of you haven't mentioned it all.
Right, so we only know of cases in one other state facility, that's Rotor. I think we have one inmate, I believe, total that's tested positive, and one staff member that I don't think was, I just got that confirmed, that we don't think was necessarily around the facility. What's going on at Green River? It's a tough situation, and you heard Michael Brown talk about the steps that we are going to take. It's really good news at this point that we don't have similar situations at other facilities. Other states are seeing this at a higher level. The reason that we're not providing numbers on it each day is because we haven't seen a significant outbreak or level. And that's one of the reasons we're not talking about Western State the way that we did before, is because that's under control. Our goal is to be transparent about areas that are really problematic. We're also putting our meat packing and processing plants up online. So anywhere where we believe that there's a significant issue, we want to be responsive and to provide that information. Here in Western Kentucky, many of our tourism firms say they are facing bankruptcy if they don't get open by Memorial Day weekend. At least two of these very important businesses are recovering from other disasters. What can be done to have social distancing and allow them to operate and avoid yet another catastrophe? Can you put up the map of Kentucky and our cases? It may be older, but Western Kentucky has been hit really hard. There are a lot of cases. I mean, look at all the red. A lot of cases. And I know that there is a rush to get things open, that people feel a pressure now. But look at that map. I mean, the people that live in these counties and around them are at a higher risk than many right now because of the number of cases. We got to be smart. And remember, if we just rush to open something up, we get another spike and then everything closes for a longer period of time. We got to make wise short-term decisions to make sure that we don't have more longer-term harm. And the number of deaths in Western Kentucky based on population, they've been tough. They've been tough to read. And let's make sure that we are making the best decisions we can from a public health standpoint. We know that the economy is struggling. That's why we are doing a gradual phased increase. But if we just open things up tomorrow, this would be a whole lot worse. Remember, we're dealing with a new normal, with a contagious, deadly virus that is out there. Let's make sure that we make those right decisions. Now, we can look at different proposals. If there's a way, for instance, on boating, we've been able to deal with auto and maritime dealers that sell. There may be ways to operate docks very safely that keep people away from each other. But if the business is based on a mass gathering of people together, people lose lives there. So let's make sure that we make smart, wise decisions moving forward. We want to open up Kentucky's economy just as much as anybody else. But if we have to close it right after, what have we really done? So my job isn't to make the popular decisions. It's to make the best decisions based on the science, based on the health, looking at the economic impacts. And at the end of the day, it's on me to make those decisions with the best advice I have. I'm not worried right now at all about politics or about popularity. I'm worried about your health and your lives and making sure that we do this right. Catherine.
When you see those headlines from other states, are you and your team rethinking your plan at all? And also, when you talk about a possible spike, making you have to roll back to phased reopening, what's the threshold there that the state is looking for?
So that's a two-part question. The first is, as we see headlines from other states, that we showed earlier? Do we think about rethinking our timeline? The answer is no, because ours have been, in my estimation, more gradual, phased out. We feel like we are at a better place than in some of these states. That's not arguing that they're not in a certain place. We believe that we've had such buy-in from Kentuckians that we can have that we have trust in that if we put out a new set of rules and people realize that helps us do more, that we can achieve more. But part of it is also what Dr. Stack has talked about. Our goal is to have the most Kentuckians following the most rules that's possible, and that's how we protect the most lives. And so, that's got to change over time with the social pressures and with the restrictions that are in place. And we've just got to do the best we can do on that. And the second part of the question was?
What is going to be the threshold that you're looking for to roll back those?
The threshold about if we have a spike, what is the threshold for knowing? A spike will be dramatic, we believe, that we'll see. It's possible that it'll be, if there was a little one day and a little the other day and a little the next day, you'd still know over a period of time. But we're also going to get some good data for healthcare going first, because if somebody now tests positive and they've been to see their doctor, a healthcare provider, over the last X number of days, by doing this gradually, we're going to know what their contacts have been and have a better idea by not opening everything up at once at a certain percentage of where the spread actually is. And so if that helps us be more surgical and more targeted about our response, if there is an increase in cases, then that'll be a good thing. What is my concern with opening up county by county rather than opening as a state? Can you put the map up of the counties? This virus doesn't care about county lines. And let's say that you are, a county in western Kentucky where Tennessee has started opening things up. And maybe you're Logan or Todd County, and this isn't that their county judges or anybody else have asked. They haven't. But look at what's surrounding you, right? It's a very contagious virus. I think we had 200 plus new cases in Warren County. That's why Judge Buchanan fought so hard to get more testing. And I'm glad we could be there. That's why he's fighting so hard for his people. This thing can pop up and spread really quickly. And by making sure we do this gradually as a state, we don't end up in a large outbreak in one county that then impacts the rest of the state. But just because you have fewer cases doesn't mean there aren't asymptomatic people walking around. And the most any other state has done is to consider doing this regionally. But remember, when that happens, certain counties get left out too. We can do this all together, just like we have been doing as Team Kentucky. Lawrence.
I don't have details yet, Governor, but it appears the U.S. judge has granted a preliminary injunction against your travel ban, declaring it invalid and prohibiting its enforcement. Would you react to that?
Well, I believe what happened today is we got a ruling from Northern Kentucky saying our ban on mass gatherings is constitutional and that there can't and shouldn't be mass gatherings right now. I think they made a ruling on the travel ban saying we were less restrictive than Ohio, and Ohio's version would be all right. Now, I haven't fully read it. I think we are similar to Ohio, but if the judge believes that type of ban would work, we're going to consider changing it to conform. So again, you get these rulings and you look at them. I think it's a really positive ruling because of mass gatherings, and that ought to inform some others out there that wanted that day in court on it. And I believe that the ruling wasn't based on what the plaintiff was asking, was to come over and socialize. It was based on driving through a state or coming through an airport. And if we need to clarify that, we'll clarify that. We want legal constitutional orders that still protect our people. It's never been about trying to win a fight in court. I've been in court plenty. It's about trying to do the right thing for our people. So you're not going to see me react in ways that you might have seen others in the past to court cases. If a decision helps us get where we need to go, we'll adjust, we'll work with it, and we'll make sure that we're doing the very best for our people. Utah Senator Mitt Romney. I didn't think I'd ever be asked a question about Utah Senator Mitt Romney, has proposed giving essential workers a $12 an hour raise over a 3-month period for working during the COVID-19 crisis. As governor, are you in favor of this wage increase? Well, that's something that we ought to look at. I mean, they've done special work at a very difficult time. I know that we've had employers that have raised salaries. I know that we have worked to make sure that there is health care there. I know we've done on the state side additional dollars going to facilities that are treating COVID patients. But recognizing those that have done dangerous work is a good thing. Joe.
I'm going to follow up again on the benchmarks from 2 weeks ago.
Okay.
Contact tracing was a big part of that, and the deadline for the RFP applications is Friday, and that's just 3 days before businesses start opening.
Right.
So when will an RFP actually be awarded to the point where they can hire 600 people? Because if it's at the end of May,
Right.
you skip the entire phase 1.
So contact tracing is also done by our local health departments, and they have an ability to do a certain amount until we level up past that. We are confident that our health departments can start with what we're going to be seeing as people come back to work. And remember, with the virus, you typically see it 2 weeks after somebody contracts it. So we believe we have a lead-up period to make sure that we have that full staff that's in place. By the phased reopening, we believe certainly by the time that retail is opening up, that we will have what we need in place and trained, and that's why we're doing the private sector in time to get it done. Would I like them to be in place earlier? Yes. I would have liked them to be in place a couple of days ago, but government contracting sometimes slows things down. But again, I'm confident based on how the virus works and manifests that we will have the necessary workforce in place in time. And until then, the Department of Public Health in the state, supplementing our local health departments, will get the job done. Again, let me mention that this is a 7-month solution because we can only spend these dollars up to this point. A better long-term solution would be if we had dollars every year put towards this to amping up our local health departments, because outside COVID-19 they could do such better work. But the hand we've been dealt, how the money has to be spent and how quickly we have to do it, this is the best route through this private RFP that we can go. That does not mean our local health departments aren't the best. They are the very best. It just means we got to make the best, quickest decision that we can. What's my comment to those that are concerned about their loved ones at Green River? Should they worry? Yes. Any place that there is an outbreak of COVID-19, you ought to worry. We're working hard. We've done more testing there than at any facility across Kentucky. But if this virus is there at the level that it is, you ought to be worried. And so you heard a little bit about what we're going to be doing, and you ought to follow more of what we've been doing. And I make your voices heard if you don't think that we're doing enough. Those are your loved ones. And we're going to listen. We're going to do the best we can to hear you and to do what we can in the confines of those suggestions. Tom.
A few weeks ago, you and Dr. Stack both spoke about some nursing students and medical students that were sent to long-term care centers to help out.
In Lyon County first.
Right. Are they still deployed at this point?
Dr. Stack, do we still have medical and nursing students deployed?
We do. We've gone multiple places. We've
Yes.
probably had 40 or more out at different facilities.
So the answer is we have 40 or more that have been out in different facilities. And let me tell you, that's answering the call. I couldn't have ever predicted as governor that I'd be walking into this situation. They couldn't have ever predicted in going to medical school or nursing program that they would either. But look at what they're doing. All right, Catherine, finish us off.
Encouraging messages from people who are medically vulnerable and concerned about going back to work. Is there anything that employees can do if they feel that their employer isn't doing enough to protect them?
Can you put the top 10 steps up? The question is about employees that feel vulnerable going back to work. Remember, we have the special accommodations that are here, and we need employers to be very thoughtful and very flexible with those that are in the vulnerable population over a certain age, heart, lung, kidney disease. They also need to be thoughtful about families that, again, with our inability to do childcare right now, are going to struggle. Remember that telework is still available and it's still the number one option. And that is where we should be focused on so much of this. And we got to be good people first in all this. And we got to remember that there is risk in going back to work. There is. I know it. I know everybody else knows it. So let's make sure that we do the very best we can with all of our employees. There can't be one size fits all. Let's make the right decisions to protect one another. All right, we've gone a little bit long today, but we had a lot of information. And we're going to continue to lead with information and to be transparent. Now, I need you to stick with us. We've been at this a long time, and we're going to be at this until there is a vaccine. But let's not stop at halftime in a game that we are winning. We're losing people just about every day. And I hate that we're losing people and that there's no number that's acceptable. But we would be losing so many more without your sacrifice and without your work. It's just as important that we gradually phase in healthy at work. It's just as important that we follow all the rules there. Folks, if we just get tired and we stop doing it, somebody we probably don't know is going to suffer the consequences. So our test of humanity, our being a good neighbor, it wasn't limited in duration. It isn't that we just have to pass that test to be kind and compassionate for a certain period of time. It has to be who we are to win this battle against COVID-19. We got to commit that while this is temporary, we're going to be this type of good neighbor all the rest of our lives. We're going to take care of one another. But I think that's what our faith calls us to do. I think that's what we should be doing. And that's how we come out of this in a safer place with less harm and better people as we move forward. Tonight, we're going to end you with a pretty special video, and I will see you tomorrow at 5 from right here. Thank you all very much.
You've got a friend in me. You've got a friend in me. When the road looks rough ahead and you're miles and miles from your nice warm bed,
just remember what your old pal said. You got a friend in me.
you've got a friend in me.
You've got a friend in me.
You've got a friend in me.
We got troubles. I got two. There isn't anything that we're in.
We stick together, see it through. Oh, you got a friend in me. You got a friend in me.
Some other folks might be a little bit smarter than I am. They get stronger too. Maybe none of them will ever love you the way I do. Just me and you, boys.
And as the years go by, our friendship will never die.
Gonna see it's our destiny.
You got a friend in me. Got a friend in me. You got a friend in me.